My name is Dr. Samir Siraj and today I'm here to give you some basic information and overview regarding kidney stones. Now, most of us have either been through or heard about kidney stones. We are always wondering, why does this happen to me? Well, the main factor or the cause for the formation of kidney stones is the concentration of various different minerals in our urine. The basic fundamental is that if the urine is expelled out of the body in a regular manner, the crystals will not have time to come together and form a stone, either small or big, right? If you don't drink enough water, then that is the primary cause or the reason for the formation of the kidney stones. Coming to the types of kidney stones, there are a few different types. Calcium oxalate stones are there, struvite stones, purine stones, but the type of the kidney stones is not so important. If you are facing this problem again and again, then your doctor will order you some tests, will see the type of the stone that you are suffering with, and will give you some specific treatment for that. But other than that, the main treatment for the kidney stones per se is hydration. The more amount of water you drink, the clearer your urine is, the less the chances of a urine stone forming and you suffering from it. What are the symptoms of a kidney stone? How can you tell that I'm suffering from a kidney stone? Well, the main symptom which the patients present with is pain. You start having pain in the flanks of your abdomen, either on the left side or on the right side, sometimes on both the sides. And that pain is generally radiating to the front, towards the groin, towards the bladder. The pain of the kidney stone is such that sometimes it is very, very difficult to either sit or stand or work or do any other things. It is that severe, and generally people have to call an ambulance for it. Such cases, the kidney stones are quite large in size and they have gotten stuck in the urinary tract, which requires a different type of treatment. If you have a pain which is transient, which happens in the aforementioned locations, but it goes away after say 10 minutes or after say 15 minutes or after say 30 minutes, then there is nothing to worry about. It might be because of a small kidney stone. If it continues to happen more and more frequently, it is better to get it checked, and it is better to continue to stay hydrated. So we were talking about the symptoms, and the one main symptom of the kidney stone is pain. But there might be some other things that you may feel or you may experience which can be because of kidney stones. Increased frequency of passing urine. You have to go to the bathroom again and again and again. It can be because of stone. Any type of pain or any type of burning sensation on passing urine can be because of a stone. Any bleeding that you see in the urine, whether the urine is of slightly reddish color or whether you are having frank bleeding in the urine, it can be because of the recent passage of a kidney stone. Right? Now, what are the different types of tests that you can do in order to find out whether you have kidney stones or not? First and foremost, in cases of large kidney stones, we can see them on an abdominal X-ray. In cases of a smaller kidney stone, say around 3 millimeters to 6 millimeters, we can see them on an ultrasound. But by far, the best test to do for this will be the CT scan for the KUB system, that is the kidney and the urinary bladder system. It can diagnose very, very small stones, and it can give us much more detail than an ultrasound can. Right? A lot of people, a lot of patients, they come and they ask, what type of foods should I eat? What precautions should I take in order to avoid these kidney stones from happening again? I would like to reiterate that hydration is the key. There is no such single food item or 3 or 4 food items that you can avoid which will cause reducing in the amount of kidney stones or the frequency of the kidney stones that you are having if you don't stay hydrated. If you are actually staying hydrated, it does not matter what you eat or how much you eat, you're going to be fine. We had a short talk about how to detect and the various type of tests that are done to detect the kidney stones. Let us have a brief overview about the treatment. Now, as I said before, the kidney stones can vary from 1 to 2 millimeter in size up to 6 millimeter and even larger. There are kidney stones with 18 and 20 millimeter in size also. So as far as the kidney stone is 5.5 to 6 millimeter or lesser in size, it can be treated with medicines. It can pass through your normal urinary tract and you should be fine with the medicines itself. However, sometimes it happens the kidney stones get stuck in the ureter, in the tract, and the pain increases even after taking the medicines, in that case, we have to go for removal of the kidney stones. So after listening to all this, there is no reason to be concerned. In conclusion, I would like to say that instead of the kidney stone becoming 6 mm or bigger and you having a lot of pain and rushing to the ambulance and the doctors and the surgeries, just stay hydrated, maintain your water intake on a daily basis, and you will not have to face the problem of kidney stones. And that's all for today. Thank you.